think it was around grade 8 or 9 when I couldn't see the board anymore. I
started working in the IT field, and obviously with that I have to work on the laptop every day. Then at the age of 21 I had to start wearing glasses.
7 years ago I picked up my phone and found that to read text was getting sort of really difficult.
I started having my issues in my late 20s, and from 30 years old I started wearing my glasses.
It was impossible to go to the movies and enjoy a 3D movie because I had to wear 2 sets of glasses, and if I didn't have my own glasses on I couldn't enjoy it because I couldn't actually see what was happening on the screen.
Technology has had a remarkable impact on medicine during the last 25 years, particularly in eye surgery, with the development of sophisticated ophthalmic lasers and diagnostic equipment. This program presents information on these developments, namely the excimer laser treatment, an exciting development which makes possible the permanent correction of eye defects such as short-sightedness, astigmatism and long-sightedness.
Hello, I'm Dr. John Hill. People have always tried to improve their vision. Back in ancient China, people used to sleep with little bags of mercury on their eyes, and this would flatten the corneas so that when they woke up in the morning they could see quite well. Later in the 13th century we saw the introduction of spectacles, and in the 20th century we had contact lenses, first hard and then soft contact lenses. But unfortunately all these devices allow you to see well, but only when you're wearing them. So of course when you take them off, your vision goes back to where it was. So we've always looked for a permanent solution. Now we have the excimer laser. This technology allows us to reshape the cornea and correct the optical problem so that you no longer need to wear glasses or contact lenses. But before we go on and discuss the excimer laser, let's have a look at a few optical problems that people have.
In the normal eye, light rays enter through the cornea, the window of the eye, and are bent or refracted so they focus perfectly on the retina at the back. Being able to see things up close but not far off is called myopia, more commonly known as short-sightedness. In myopia, the eyeball is too long, or the cornea is too curved, so the incoming light rays meet and focus in front of the retina and the image is blurred. If you are long-sighted or hyperopic, light rays focus behind the retina and the image is also blurred. Sometimes the shape of the eye is irregular and shaped more like a rugby ball than a soccer ball. This is known as astigmatism. Light rays are focused in more than one place, resulting once more in a blurred image. All 3 of these conditions can be corrected by placing a lens, either spectacle or contact, in front of the eye. The whole object is to get light to focus accurately on the retina, so that the image formed is clear and the signal sent to the brain can be precisely interpreted.
So, with the excimer laser, we're able to accurately reshape the cornea so that the shape of the cornea matches the length of the eyeball, and this corrects your short-sightedness or long-sightedness. The treatment itself is painless. We use anesthetic drops that numbs everything. There's no burning or cutting, but the laser just gradually evaporates the tissue away. And the usual treatment takes between about 4 and 15 seconds only. Originally, we applied the laser directly onto the surface of the cornea. This is a procedure known as PRK. And although we tend not to use it nowadays, because afterwards we leave a raw area on the cornea that is quite painful and takes a few days to heal completely. Nowadays, we prefer the LASIK procedure. In the LASIK procedure, we raise a small corneal flap, rather like a trapdoor, and then apply the laser underneath it, and then put this flap back at the end of the procedure. And the advantage of this method of treatment is that there is no pain or discomfort afterwards, and the healing is much quicker.
To establish whether you are a suitable candidate for the excimer laser treatment, we will first perform a detailed examination of your eyes to ensure that there are no eye diseases. If you wear contact lenses, we will advise you how long these should be left out prior to the examination. The examination includes a number of special tests that are designed to establish very accurately the precise shape and refractive error of your eyes. First, we use a topographic camera to create a detailed relief map of your cornea and also detect any diseased or abnormal areas. The corneal thickness is measured, and a wavefront camera uncovers any aberrations of the light rays entering the eye. When combined, a high-resolution image is then created, which we feed into the laser so that it can calculate a custom treatment for each individual eye and lock onto the eye and track any movements during treatment. On the day of the operation, you will need to be accompanied by someone. They can drop you off and pick you up so that you don't have to drive home yourself. In the laser room, we begin the operation by lying you on a special motorized bed under the operating microscope. The surgeon then puts some anesthetic drops in your eye and inserts a small speculum to keep your eyelids open. The surgeon will talk you through each stage of the procedure because, remember, you are fully conscious at all times. In the LASIK procedure, the tiny flap on your cornea now has to be raised, and after final adjustments, the laser begins to reshape your cornea. While this is happening, you will be monitored carefully, and if you look away from the green fixation light, the laser will follow your movements and no harm will be done. After the short treatment, the flap is put back and the procedure is complete. We will give you both antibiotic drops and artificial teardrops for the scratchiness you may experience during the first few days. We suggest you go home and lie with your eyes closed for a couple of hours to speed up recovery.
There's no pain during the laser treatment. You feel some slight pressure at the beginning, and then when the anesthetic drops wear off, it's dry and scratchy for a few days, but this passes quickly. Now, we normally see you the next day, and then a few days later, and then we schedule appointments thereafter, depending on how well you're doing. Many people obviously are quite concerned about the safety of the laser. Well, the first laser was performed in 1986 and commercially became available in the mid-90s, which is when we started doing treatments ourselves. Since then, there have been major advances in laser technology. This has made treatments safer, quicker, and much more accurate than before. So, what sort of results can you expect? Well, over 98% of people will be able to see 20/40 vision, which is the legal limit of driving, and we expect virtually everybody to be able to see 20/20, which is normal vision. However, you need to consider the matter carefully. Like all surgical procedures, there can be complications, even though these are very rare. So your willingness and ability to follow instructions and to attend follow-up appointments are essential to ensure a good result. It's important to realize, though, that some people will still need glasses for fine detail. Also, those of us in the 40-plus age group are still going to need these reading glasses. Unfortunately, there's nothing that we can do about that at the moment.
The whole procedure was actually sort of well thought through. You get explained right through the whole episode, sort of each step gets explained to you.
Pain-wise, no pain at all. They do give you something before, which wasn't even necessary.
Yeah, and the operation was really quick.
I have really two words actually, and life-changing are those two words. It's actually, the whole experience has been amazing.
I mean, the biggest thing for me was to be able to go and watch my daughter play her sports and watch her run around and be able to do those things with her.
Sometimes when I wake up in the morning, I still want to grab the glasses, and then I realize, wait, I don't have to do that anymore.
This program does not attempt to present every aspect of excimer laser treatment. It is intended to act as an introduction to the procedure and to help you come to an informed decision about whether to proceed. Please contact us for a free screening test to see if you are likely to be a suitable candidate.